Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from the Health 2024 in sunny Las Vegas. For today, I have a fantastic lineup of CEOs, CIOs, care providers, policy leaders, and visionaries. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all of these changes occurring across healthcare. There's more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from Health 2024 in sunny Las Vegas. I am very excited to announce my next guest and great friend of the show, Dr. Rasu Shrestha, Chief Innovation and Commercialization Officer and Executive Vice President at Advocate Health. I think all my guests know you anyhow. I don't need to announce this anymore, but welcome back to the show. Big welcome.
Thank you, Justin. It's an absolute pleasure to be back.
Thank you, my good friend. So before we dive in, when did you get in town and what's fun, what have you seen in here that's kind of cool?
Yeah, so for me, this health has really been a quick 48-hour sprinting the marathon, so to speak, right?
Absolutely.
So just got in yesterday around lunchtime, and I leave around lunchtime tomorrow. But it's been great. It's been a fantastic show, and you're able to pack in so much of in-person conversations in such a short amount of time. And with all the Zoom calls that we're in these days, the face-to-face time is so important.
It's precious. Yeah. It truly is. So what's your goal for coming here? I mean, obviously, you speak here, you bring your knowledge here. People want to come and learn from you. But what do you get from this? Collaboration for one thing, relationships. But what else do you get?
Yeah, so it's been, this year in particular, has been extremely targeted, right? Really focused in on a number of specific deals and partnerships that we're trying to push forward with. Excellent. And it's been very focused.
Okay, terrific. So I like to start off with something positive. What progress are you most excited seeing in the industry today?
Yeah, on the positive front, one thing I have to call out is really the health at home movement. Right? If you think about this, this was not really a thing for a long, long time.
Right.
And today, on this side of the pandemic,
right,
I think a lot of folks are really starting to understand the need for us to meet our patients, our consumers, the people, our communities where they choose to meet us. And it's not just the hospital at home program that we have continued to push the boundaries of, and we now have the largest hospital at home program in the country.
That's awesome.
Just in the latest count is 11,000 patients through our hospital at home program. It's just remarkable. That's 45,000 bed days saved. It's just remarkable, and 25% cheaper to treat the patients at home for the same acuity of patients that would have otherwise.
And their quality of life is 10 times better being home.
Quality of life, experience, all of that, right? So it's just absolutely amazing. And then broadening that to not just acutely ill patients that we're treating in the hospital home program, but chronically ill patients that we're discharging with remote patient monitoring. And right, how do we make sure that we're nudging the behavior in the right way so that they don't fall off the guardrails, and we continue to maintain them in that circle of wellness. And then all the way to the other end of the spectrum, the worried well, the likes of you and I, right? And I think that's a huge opportunity. So just seeing that play itself out, I think that's a long time coming. Because if you think about this, for the longest time, not just for the last 3 decades that we've been rolling out electronic medical record systems and PACS systems, but for the longest time, healthcare has been about sick care.
It has.
It's about, treating an illness and getting better from an illness and not dying. Whereas now we're starting to talk about thriving and not just surviving, but thriving.
Right. Yeah. Absolutely true. So what healthcare or digital health trends, are you seeing out there that you're engaging, or you recommend that we engage?
Well, obviously AI is everywhere, right? But it's not just AI for the sake of AI. I think it's really purposeful AI, and I urge everyone to really say, all right, let's make sure that we're able to identify the why, not just the what and the how.
That's
right? I think that's really, really critical. More so with the power that Gen AI brings to the table. At the same time, making sure that we're able to define the guidelines and the guardrails, I think that's really critical as well. So with Microsoft and a number of other health systems, we founded TRAIN, the Trustworthy Responsible AI Network, really sharing best practices around trustworthiness and responsible AI, and how do we make sure that we're able to together really get at these elements in a much stronger way. The other big component that I thought I'd share with you is I'm super excited about this. So I don't know if you know this, Justin, but CMS is coming out with a CPT set of CPT codes that are specifically for AI procedures.
No. Oh, I heard that. I just heard that yesterday for the first time.
It's amazing.
Yes.
So this is AI QCT and AI CPA. I wanted to make sure that I got that right. So for patients with coronary artery disease or suspicious lesions around CAD, coronary artery disease, these are specific CPT codes that are tied to AI, right? I mean, this is just absolutely amazing, and it's going to take effect November 24th, so that's just around the corner.
So the only reason I know is because you posted that,
Yeah,
right?
I did.
That's what I know.
Yeah.
I read what you posted.
There you go.
I just read that yesterday.
You read my stuff. That's great.
I love it. Oh gosh, it's extremely insightful.
Yeah.
So I was to do a follow-up. I broadcast from a conference about a month ago, and I had several CIOs come across extremely excited about what AI is doing for their healthcare organization today. Because we always talk about, it's been years and years and what AI is going to do for us. It's been a lot of future talk. What are you most excited about AI doing inside your organization, Advocate, today?
Yeah, so today, right, we're really embracing the power of conversational AI, Gen AI, so to specifically address the burden that physicians and clinicians have in documentation. So the documentation burden issue is a real one.
Yes,
and it's also a real opportunity with AI because it's actually pretty darn good. And so we were one of the earlier sites to really play out and put into implementation the Nuance DAX platform. And we're now, I think, the largest site for the Nuance DAX implementation, and the results have been absolutely amazing, right? And my clinical colleagues are coming to me and saying, look, I get to go home on time. I get to empathize and actually have a conversation with my patients. I get to relate with my patients in ways that I've never been able to relate to them with. And really, this is the reason I got into healthcare in the first place. This is the reason I became a doctor in the first place. And I get it. I absolutely get it. So I think it's quite amazing. So with the patient's permission, we're recording that encounter, basically, right? And at the end of that encounter, anywhere from 75, 80, 95% of the documentation is complete. Right? It's just beautiful.
Excellent. Wow, that's impressive. So what are a few best practices, 2 or 3 best practices or strategies that you would share to help people navigate, what you just spoke about, some of the trends that you're talking about and Gen AI and what it can bring to their organization, inpatient, outpatient health system?
Yeah, so not just with Gen AI, but digital health in general. I love to talk about how, you can't just throw digital after broken processes, right?
Absolutely.
Because you're going to end up with right, a broken digital process.
Absolutely. So
I think that's really critical, especially with the computational horsepower that Gen AI brings to the table as well, right? And so I always say, all right, find the purpose behind what it is that you want to do, right? What's the why, right? Let's make sure that we're able to specifically address that. And then make sure that you're also able to track to the guidelines and the guardrails as we talked about earlier. But also, I think it's important to get to the ROI argument.
Absolutely.
I think that's really, really critical, right? So there's not just about chasing shiny objects. In fact, it should not be about chasing shiny objects whatsoever. It really should be getting at the ROI behind these implementations. I think that's really, really critical as well.
Yep, and actually there's a piece that you also put out there, and it might be the same one, is to be very careful with that shiny object syndrome.
Yep, absolutely, that's right.
Yeah.
There should be an ICD-10 code for the shiny object syndrome in healthcare.
I love it. So thinking beyond today, what do we need to be ready for in 2-3 years from now? I know it's hard. When I asked John this, he's like, I don't even know 2-3 quarters from now, never mind 2-3 years from now. But thinking about, with respect to the great Wayne Gretzky, where the puck's going to be, you skate to where it's going to be, not where it is. What are you thinking about with Advocate? What are you thinking about 2 or 3 years down the road to be ready for?
Yeah, so a couple of sort of mind shift type things that I think are really critical for us collectively as an industry, and we are absolutely focused in on this at Advocate Health. So maybe I'll throw 3 things out there. One is it's important for us to broaden that aperture from more of that patient-centered approach to care to more of a person-centered approach to care. And I think that's really critical. The patient is always in the center, right? Me as a radiologist, and I'm not going to move away from the patient. The patient is always at the center, but we've got to broaden that aperture. And what that means is you're looking at broader sets of data, broader sets of motivators and detractors, habits, nudges, right? So you're taking into account not just the social determinants of healthcare, but really all of these other behavioral elements that drive towards nudges in healthy behavior, which I think is really, really critical. Absolutely. I think that also then leads itself to the economics of getting better from an illness and staying well, right? I think that's really critical because that's where we've faltered for the longest time in healthcare. That's one. The second, and I talked a little bit about this, but really moving from just the bricks and mortar focus that we've had to connected care everywhere, right? It is about that continuum. Home is where the health is. I'm super excited about the work that we're continuing to lead in that front, and I think that's really critical. The third, I think, is really focusing and moving that focus from what I've called transactional healthcare. That's what we've been doing for the longest time. These are transactions. It's an ICD-10 transaction. It's a CPT code transaction. It's a billing transaction. It's a transaction to more of an experiential healthcare, right? Let's focus in on those experiences, those moments that really matter, right? When a patient comes to a clinic, the first thing that me as a physician or we as a health system ask them is, why are you here? Right? What's the matter with you? The question should really be, what matters to you? Right? Not what's the matter with you.
Right.
So really focusing in on those experiences, the things that really matter to that N of one, to that human being, right? They could be in a certain trajectory in their journey forward. They could be faced with certain challenges. They could be at a certain point where they're planning for a wedding, or they want to walk their daughter down the aisle, right?
That's right.
So it's important for us to really understand what matters to that N of one, and then create those experiences around that individual.
Yeah. Going back to the quality of life and what they want, and you also bring up something near and dear to my heart is chronic care management, value-based care, but not the economics, but more the quality of life that comes with that. Those little nudges that you talk about that can make a real difference, demonstrable difference in someone's health, short-term and long-term. And then the quality of life that you bring back to them through those little nudges. And so, that's a real simple way to cover it, but that's kind of what that's why I get very passionate about it. I do a lot of thought leadership writing on that just because people aren't taking it as seriously as I think they should be. It's so much opportunity there. It's so much opportunity selfishly as a patient to go in and engage that, because you will feel better. You will have a better life. You will reduce your long-term healthcare costs. All that from just little micro steps today. So, love it. Rasu, thank you so much for joining me on air as always. Make sure your DN's card is open for HIMSS 25 because we're going to do a great show there next.
Excellent.
Right,
Thank you, Justin.
Thank you, Rasu. Welcome back to This Justin Radio Show, broadcasting live from Health 2024 in sunny Las Vegas. I am very, very excited to introduce my next guest and great friend of the show, Dr. John Halamka, president of Mayo Clinic Platform. Welcome. A big welcome back to the show, my good friend.
Thrilled to be here, and you are a true friend and colleague. Thank you.
Thank you, John. So before we dive in, I assume this has been a great couple of days. You've been here for 2 days now or so?
So I came over the weekend to help co-chair the Coalition for Health AI meeting. So about 300 folks, government, academia, and industry coming to build the guidelines and guardrails for predictive and generative AI. Very positive work.
Yes.
And then, of course, here we have 12,000 of our closest friends. You can't find a quiet place. No. But you see every HLTH or health, however you want to pronounce it, has a different flavor. And this is, of course, generative AI, augmented human care delivery, various kinds of ambient listening. Those seem to be the popular items of the day.
Yeah, very true. And you may not know, but I actually was appointed to the direct-to-consumer work group within CHI. So I'm actually going to, I was there yesterday. I made it just in time for our kind of our first work group meeting, unofficial. I don't think we're officially brought it all together yet. I think it's still another couple of weeks before we actually come together. But I was able to join them, and I'm excited for that.
Well, it's all about the patients.
Amen.
Some of us are doctors, but all of us are patients.
That's right. Amen. Very true. So I guess start off on a positive note. What progress are you most excited seeing in the industry today?
So as we were talking about a moment ago, I've been doing this for 40 years.
Yes.
40 years ago, there were no electronic health records. And then, we decided to digitize the paper.
Yep.
And then we started to create standards. And then we decided to create policy for interoperability.
Yep.
Well, today, we can create predictive and generative AI from highly curated, normalized data sets, not only within one organization, but across organizations, so that we could develop something at Mayo and then test it and validate it at a place completely different than Mayo. That would have never been possible. In fact, 40 years ago, people would have said, that's insane.
Right.
And the fact that generative AI is going to change our workflows, is going to give doctors more time with their patients, 5 years ago, would have never predicted. It's making progress.
Yeah, totally agree. And one of the things, actually broadcast from a conference about a month ago, and what was exciting is we're now talking about how AI is helping us today in our health systems with our care plans, our care strategies, and obviously in workflows. What are an example or two that you are seeing at Mayo or that you've seen in the industry that you're just really excited? This is what AI is doing today.
Well, sure. So a couple of aspects of this. Let me start with predictive. So remember, predictive AI is just math. It's looking at some input, text or telemetry or a picture, and helping do diagnosis or analysis. At Mayo, we have an algorithm that can detect pancreatic cancer 2 years before any human.
Wow.
And why? Well, because there are subtle microvascular changes at the head of the pancreas that a human eye can't see, but an algorithm can. And we see this over and over. I mean, same thing with looking at ejection fraction in cardiology, detecting neuromuscular disease like ALS or dementia, faster cures, being able to understand who's at risk and customize the medicine that we're delivering. So that's exciting.
Very.
On the generative AI side, I went to medical school in the 1980s, and a few things have changed since then, right? In my field of emergency medicine, 800 papers a day. I'm behind on my reading.
Yeah.
But generative AI could read those 800 papers a day and say, you didn't know that last week there's a new drug, a new therapy, a new tool. So that's where we're starting to see retrieval augmented generation, summarization certainly making a difference. As we know, generative AI, where you train it and then use it, not always accurate, hallucinations and fiction occur, so that we're a little more careful with.
Excellent. I love it. And that's extremely exciting. So what healthcare or digital health trends should we be looking out for or that we expect to see over the next year or so in healthcare?
Well, as we know, generative AI is moving faster than anyone can even track.
Right.
I mean, yesterday I met with one of the large generative AI companies, and they said, you're going to see the next version of our product, but the way that it is engineered is it will now take a quarter or two to update, not a year to two to update. So its improvement will be so wildly fast, the tools of the past will look ancient in comparison. So that's really intriguing. Yeah. I'm not suggesting sentience,
right?
But at least mathematically, we're going to get higher quality output with less hallucination or fabrication in 2025.
Wow.
And that's going to help us with some of the challenges like hiring and retaining staff, burnout.
Good.
And the demographic challenges where we know there won't be enough doctors or nurses to deal with the demands of an aging society.
That was my last guess. Hit on that pretty hard about, we have this tsunami coming, and we've talked about the silver tsunami. It's not necessarily that. It's the amount of people entering our healthcare system need more care, and the people that are leaving our healthcare system, also, and not having the resources. But this is where AI is absolutely a positive aspect of what we can, provide in the future. So, absolutely agree.
But one other element of that, and that is Mayo Clinic is a wonderful place to get specialty care, but look at sub-Saharan Africa, look at northern India. 85% of the population of the planet lives in low and middle income countries. So they can't even get access to a specialist.
Right.
So the other aspect of this is not only improving our workflow, but it's delivering specialty knowledge where today it doesn't exist.
Fantastic point. Love it. So what are a couple best practices or key strategies for the industry, say either a health system or provider or a company? What should they be looking at with regards to the trends that you're talking with generative AI and then, predictive AI?
So you're a journalist.
Yep.
2
years ago, Casey Ross at Stat wrote a piece called Healthcare AI Has a Credibility Problem.
Totally, I remember that.
Right,
Yes,
and
right.
the reason, well, how is it created? Is it biased? Is it going to work for the patient in front of me now? Well, these were questions that we started to ask 2 years ago. And so now with the Coalition for Health AI, this weekend we've published the nation's standardized model card. Now, what's a model card? So if I run an algorithm on you, and you are a tall and thin male, maybe it's beautiful. Does it work on a short female?
Right.
How do you know? And the model card is going to give you that kind of detail. And so I think what you're going to want, if we're going to build credibility and trust, we need to have transparency about how these things were developed and how they're used.
Yep.
Ideally, we're going to get a nationwide registry of the model cards, and a electronic health record or other tool will say, for the person in front of you now, this mathematical construct is likely to work for them.
Right.
And that's what's get executed for the benefit of the patient.
And that's extremely exciting. So what's your goal? Obviously you're going to speak here. What's your goal coming to health? You're here every year, you're at HIMSS every year. What's your goal for being here this time? I've been in CHIs would be a big piece of it too.
Sure.
But yeah, what's the...
So Mayo Clinic Platform does not try to be a centralized hub. It tries to be a catalyst. So I meet sometimes with providers. And I have heard at this conference, many providers are saying, wow, I'm actually starting to see the importance of my data. How do I ethically reuse data that is consented and privacy protected in a way that our patients and culture will accept?
Yes.
So I get to have that discussion with a lot. Well, once you have federated, curated data, then solution developers, our innovators, companies large and small, can turn that into knowledge and products that are going to help our patients. So generally, while I'm here, I try to get dozens of these innovators to now work with healthcare systems. And then how do we deploy these in such ways that, as we say, we reach those who might not be otherwise able to get care? So my role at Health is that kind of catalyst.
Love it. We do it very, very well. So now for the hard question. Thinking beyond today, what do we need to be ready to handle or navigate in 2 to 3 years from now in healthcare?
Isn't it intriguing that people ask us to predict out 2 or 3 years? I don't know that I can predict
I know.
out 2 or 3 quarters.
Exactly. I know.
But here's the hope.
Yeah.
And I'm not suggesting this is a characteristic of any one healthcare institution, but I would say healthcare generally around the world is hard to access, hard to navigate.
Absolutely.
Late stage, acute disease rather than prevention. It's expensive. So we're getting to the point where, as we've talked about with a few disease states and algorithms, it'll be proactive, wellness focused, easier to navigate, earlier stage. And this is just 2 to 3 years away. In fact, it's, as William Gibson taught us, it's actually already here.
Right.
It's just unevenly distributed.
That's very true. Now, I think it's one of the cool things, and even Rasu shared something about this yesterday, about how people think AI as a cold technology, but actually it's going to really truly personalize medicine. It's actually make it, should be quite warm. Figuring out it's going to know you. You're actually going to know it. It's going to help you with your care. It's going to be very interactive. It's going to learn. It's going to get to know you more than a care provider and augment. So, going to have a care provider. It's going to augment the care. It's going to make healthcare so much more personalized. What would you say to that?
Well, let me just give you a case about me.
Mm-hmm.
So you'll see that my left eye is a little bit red. I promise it wasn't a substance.
Yeah, I know.
It's that I had eye surgery a couple of weeks ago.
Didn't know.
So my wonderful ophthalmologist said, well, John, you're a 62-year-old male and your eyeball is very long and you're very myopic. There are 3 procedures that might work with you to reduce your glaucoma pressure.
Mm-hmm.
And I said, well, shouldn't you actually look at 1 million people with long eyeballs that are in their 60s, that are very myopic, and say, actually, this is the one.
This is the care plan. Yeah.
And that's the point that you're making.
Yeah.
It will no longer be an anecdote, a guess, or variation based on a physician's experience. It will be math.
Love it. That's extremely encouraging, and I'm glad my audience heard that. So in our last minute, very important, near and dear to my heart, is Unity Farm Sanctuary. Please give me a couple minutes. Tell my audience how it's grown, what's new there, how's Dudley doing, all that good stuff.
Excellent. Well, now 360 animals.
Yeah.
We are the place in New England where the abused, neglected, abandoned large animals come.
Mm-hmm.
I thought this was going to be for our preachers, but to be honest, it is for our community.
Amen.
And we now have a 24-student preschool that is an outdoor preschool year-round, teaching our young kids that playing in the mud is okay.
I love it.
We have programs for the autistic and the elderly. So almost every day there is some community benefit. So I guess the reason it brings me such hope and richness, we may live in a time of polarization and isolation, and I get to live in a community building environment every day.
Amen. Fantastic. Well said. Please pass along my best to Kathy as well. You guys do a phenomenal job, and I highly recommend everybody check out Unity Farm Sanctuary. It's a great endeavor. John's done it for many, and Kathy's done it for many, many years. It's certainly worth your time and investment. So
excellent. Well, thanks for having me.
You got it, Dr. Halamka. So good to see you, my friend. Many thanks to my show supporters and partners, and certainly to Rich Scarfo and the entire health team for this opportunity to broadcast live each year from the health conferences, and this year from Health 24 in sunny Las Vegas. And a big thank you again to all of my listeners and all of my supporters. And please tune in as we broadcast these shows weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can find me on my LinkedIn at Justin T. Barnes, or track me on Twitter at HLT Advisor, and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you miss any of this broadcast and want to hear any of my shows, they're all posted at Amazon Music, YouTube, Spotify, Pandora, Apple Podcasts, iHeartRadio, SoundCloud, Spreaker, and on the TuneIn platforms. And also, you can check out some of the new content that we published on the Thought Leadership page at justinbarnes.com. Thanks, everyone, and have a great rest of your day.